suerte hay en este momento 90 personas esperando y hay más de 250 registrados. Abrimos en 3, 2, 1. Mucha suerte.
Buenos días en la sala, por favor, ¿pueden silenciar un momento el micrófono, por favor? En lo que iniciamos. Bien, muy buenos días con
Good morning
todas y todos.
to everyone.
Viendo que ya se
We
están sumando
see
todos los participantes.
all
Muchas
our
gracias por
participants
su
joining us.
puntualidad en
Thank you
conectarse
very
a
much
este
for
webinar.
connecting to this webinar.
Para iniciar, primero queremos mencionarles
To
que en la parte inferior de la
begin,
plataforma Zoom
we'd
tienen
also
disponible el
like to
botón para activar la
mention
interpretación de audio en inglés si
you
lo
can go
necesitaran.
down to the lower
Además,
right-hand
durante las
corner and click on
presentaciones
the
les invitamos
icon
a dejar
for
las preguntas y
interpretation
comentarios en el chat,
services.
que se
You can
encuentra
also
habilitado
post
para todos los
questions
participantes.
on the
Voy a
chat
pedir
box
también
that has been
se
facilitated
confirme
for
que
your
está grabando.
use.
Sí, correcto.
And we're confirming now that we are recording.
Y por favor, dejamos de
And
compartir el banner. Muy buenos días a todos y todas.
good
Por
morning,
parte de la Organización
everyone.
Panamericana de la
On
Salud,
behalf of the Pan
Organización
American
Mundial de la
Health
Salud y el
Organization,
Ministerio de
the World
Salud de
Health
Perú.
Organization, and
Tengo el
the
agrado de darle la
Peruvian Health
bienvenida
Ministry, it's a
al
pleasure to
webinar
welcome you
Innovación en el
all
registro de la
to this
vacunación
webinar,
con soluciones
Innovation
digitales
in
interoperables
Digital
del papel
Solutions
al
and
verbo digital. La
Interoperability in
experiencia con los guías
Comprehensive
benchmarks de la
Immunization,
OMS en Perú.
experiences
Este evento
gleaned in
virtual es
Peru,
posible gracias a la
working with
cooperación
WHO.
técnica que
This
brinda la OMS
event
al
is thanks
compromiso del
to
gobierno del Perú
technical
a través del
cooperation
Ministerio de Salud
provided by
y las
PAHO, working
contrapartes
with
de
the
los
Ministry of Health,
departamentos del país
and
y el
our
apoyo de
counterparts
nuestro
in the
socio,
various
la
departments,
cooperación
and the
alemana
support
al
by
desarrollo
our
e ICET.
the
Mi nombre es
German
Adriana Navarro y los acompañaré
Development
en la
Cooperation
moderación de este espacio
Organization.
virtual.
I am Adriana, and I'm
Saludamos y
going to be
agradecemos la presencia de todos los
moderating this
participantes en
event. We
línea
would
que nos
like to
acompañan
again
desde
thank
diversos
everyone for
países de la
joining
región,
us from
interesados en
various
conocer
countries
la
throughout the
experiencia de
region
Perú
who are
en esta
interested in
iniciativa
learning
de
more about
transformación
the
digital para
Peruvian
la salud.
experience in digital
Para dar
transformation for
inicio a
health.
esta sesión, vamos
To
a
begin the
invitar a la
session,
magíster
we're
Piedad
going
Huerta,
to
jefa de la
invite
Oficina de
Piedad
Cooperación de
Huerta
Países y
from the
Subregiones en la
Office of
OPS-OMS,
the
a dar las
Regions
palabras a
and Country
continuación.
Cooperation
Adelante,
at
Piedad.
the
Muchas
WHO.
gracias, Adriana.
Thank you.
Muy
Thank
buenos
you,
días,
Adriana,
tengan
and
todos y
good morning.
todas. Buenas tardes, las
Good
personas que nos están
afternoon,
viendo
those of you
en
who
el
are
otro lado del
listening
mundo. Sabemos que
from
tenemos
throughout
ahí
the
personas
rest of the
registradas
world. We know
también
that we have people
en
who have
países de
joined
otras
us
regiones. Así es que
from countries in
estamos
other regions.
sumamente
So
contentos
we
de estar
are
en
very
este día con
pleased
ustedes
to
presentando
share this
este
presentation
importante
with you,
recurso
a very
que
important
está ya
resource
disponible en Perú y que
that is
esperamos
now
que en algún
available in
corto
Peru, and we
plazo pueda
hope that in the
hacerse
short term
disponible para otros
it will
países
be
también.
made available to
Saludo
other
con mucho
countries as
gusto
well.
a
And
las
greetings
personas que me
to
acompañan en la apertura de
those
este
who
webinar,
are joining us
al
with the
doctor
opening of this webinar,
Cristian Díaz Vélez,
Dr.
director de Intervenciones
Cristian
Estratégicas de
Vélez,
Salud
Director
Pública
of Strategic
de Perú.
Interventions in
Muy
Public
buenos días,
Health from
doctor.
Peru. Good morning,
Felicidades y
Doctor,
gracias por todo el
and
apoyo que han dado para este
thank you
trabajo.
for all your
Al
support in this
doctor
effort,
Sebastián García
as well as
Saizo,
Dr.
quien es director
Sebastián
del
Garcia
Departamento de
Baiza,
Evidencia e
who is
Inteligencia
Director of
para
the
la
Office
Acción
of
en
Evidence
Salud,
and Intelligence
OPS-OMS,
in
socio,
Health
participante,
Interventions
socio
for
y
PAHO,
ejecutor
a
importantísimo en esta
participant and a
iniciativa,
very
así
major
como a Hugo Rasuri,
implementer
quien es
of
el
this initiative,
director
as well as
adjunto
Hugo
del
Rasuri, who is
Departamento
Associate
del
Director
Programa de
of the
Inmunizaciones en la Organización
Department
Panamericana de la
of
Salud, el otro
Immunizations at the Pan
elemento
American Health
técnico
Organization, which is the
fundamental
other
en esta
fundamental
iniciativa.
technical component
Estimadas y
used in
estimados
this
miembros
initiative.
del
Esteemed
Ministerio de Salud,
friends, the
colegas
Ministry
de
of
la
Health,
OPS y
colleagues
participantes,
from
tengan
PAHO,
todos muy
and
buenos días y
participants,
reciban una
good
cordial
morning.
bienvenida
And
a
again, we
este
would like to
webinario.
warmly
Es un
welcome you to
honor
this webinar. It's an
dirigirme a
honor
todos ustedes en
to
nombre de la
address all
Organización
of you on
Panamericana de la
behalf of
Salud
the Pan
y
American Health
transmitirles el
Organization
saludo de
and
nuestro
convey
director, el doctor Carlos
greetings
Barbosa
from our director, Dr. Jarbas Barbosa da Silva, who has recognized the significance of this forum for technical exchanges that share best practices that help to advance public health in the Americas. I'd like to start by expressing our recognition to the Peruvian Ministry of Health for their leadership in the implementation of the project, which reflects the commitment by the country in the area of digital transformation that will benefit the community, in particular those areas of remote or difficult access. Also like to express our profound thanks to the Office of German Development Cooperation, known as CITA, for its strategic vision and constant support for its funding of projects like this one, and for serving as a strategic partner in this project that has been directly joining us with technical know-how and a strong motivation in improving the tools for the local and regional authorities that have contributed to this initiative. Liseta, thank you. I'd like to take this opportunity to also recognize the commitment and determination of community stakeholders. Without them, the results would not have been possible. It's important to also recognize all of the efforts undertaken by the Pan American Health Organization country office here in Peru, together with the technical team that has provided that follow-up, working in unison with the various levels of the organization, including the Initiative for South America on the regional level, with all of the technical departments that are present here. This project, which was launched in December 2022, originated with the aim of strengthening information systems in healthcare through digital solutions adapted to contexts, including remote and difficult access to the Peruvian Amazon region and those remote areas linked with other countries. This part of the project focuses on the implementation of this app, of this product that we're going to share with you today, and similarly, other key results and outputs that have to do with human resources training. We have the offline app that was developed under interoperable international standards following the WHO guideline, the SMART. That's the acronym in English. This tool allows to record immunization information right in the areas where care is provided, regardless of where that care is provided, and sometimes in the absence of connectivity, and facilitates subsequently the synchronization of data with the national systems. Its design incorporates various functions that are key in ensuring traceability and the quality of information, providing a quantum leap in terms of recording of information as opposed to paper recordings. We also have the support in digital applications in addition to manual collection of information. We wanted to compare both to see what the value added is with a methodologically accepted system. This provides valuable information regarding the effectiveness and efficiency, as well as opportunities for digital resources, and is a key input for helping make future decisions on digitalization efforts in the areas of low connectivity. The innovation needs to go hand in hand with strengthening skills, and that's why this project envisions strengthening digital competencies in healthcare staff through a massive and open virtual course developed together with the INSAP School of Public Health, and it is crucial in the virtual campus and included at the PAHO website. This is going to be discussed in more detail in a subsequent event. So now let's move on. After the protocol greetings, it is a pleasure and honor to be here with you and be able to officially launch these significant events. Although we are now formally closing the launching, this is just the beginning of digitalization efforts in the immunization field in Peru. Thank you, Piedad, for those words of introduction. And now we invite Dr. Christian Diaz Velez, Director of the Strategic Interventions in Public Health in the Ministry of Health of Peru. Good morning, all of those who have joined us virtually and those of you who are here in person with us. We want to thank you for all the efforts, hard work underway. The Ministry of Health has 25 strategic lines of effort where we conduct several activities. We have the immunization, where we address not just including recovering and increasing coverage, but for that we need many strategies that will help in innovation processes and that will have a more significant impact in ensuring greater coverage, including populations such as adults, adolescents, the elderly. One of the lines of effort that the Minister of Health always reiterated was the need for the use of technology. The use of technology that will lead to actions and better decision making. And in this specific instance, we're transitioning from paper data and records to digital records. So in 2024, where we were working with the measles issues, and we already focused on having more information on immunization. This has helped us to take action, and we were identifying household by household children that would need immunizations, and not only because we've identified these children and their locations, but also because through georeferencing technology, we're able to identify these pockets of children that could be susceptible to preventable diseases, preventing outbreaks of diseases. And we know this is happening in countries around this region, including yellow fever, measles, that have affected parts of the countries. To have these tools, digital tools available, and this is through smart technologies developed by PAHO, and it's part of our healthcare toolkit. To have this app offline, that is a strategy. This will enable not just a quantum leap in having real-time information, but also in terms of quality of information. We will be recording this through the teams of immunization professionals, not only having, of course, recordings of digital information that sometimes could be erroneous in terms of transitioning from paper to digital, but all of this information that we're going to obtain will allow us to make decisions in real time and better decision making so that we can respond immediately. And this goes hand in hand with the Ministry of Health's updating of technical guidelines in immunization. It's not just readjustment in the follow-up and evaluation efforts, in immunization, but also looking at the online and the computer updates. Not only do we have a technology tool here, but we need to make sure that these standards will remain and hold up over time and have digital data, because digital data will allow us to share information, which will contribute in turn to better decision-making processes. We want to thank PAHO, with whom we are coordinating efforts constantly, not just in the field of immunizations, but in other health interventions, and all of those who are participating, providing technical assistance in the use of this app, and those who have helped us to contribute that grain of sand in improving strategies, looking at vaccines, immunizations that are among the key and most cost-effective measures in public health. Thank you very much. Thank you, Dr. Diaz, for those words. And now let's offer the floor to Dr. Garcia Ceso, Director at PAHO in the area of health and immunizations. Thank you. Good morning, and special greetings to Dr. Christian Diaz for those words and that very important message. And colleagues who are, I know I can't see one, but I know she's connected. I see, and I'd like to thank Dr. Hugo Rasuri, our point of contact in immunizations, working with ICETA, the German Office of Development Cooperation. So, and also want to thank all of you who have joined us. This reflects the relevance that this type of initiative has, not just for Peru, but for all of the countries in the Americas. It's an honor to be able to be with you today. This is a moment that's been described as, although the crowning touch, but we're not really crowning or ending anything. We're looking at the beginning of a new phase based on the efforts undertaken over the last few months in this comprehensive and overarching technical initiative, which includes efforts coordinated between the Ministry of Health, the German Development Cooperation Organization, and the Pan American Health Organization. Both our country office in Peru, as well as our liaison and link in Washington, we thank you and convey our greetings. This project, which has already been touched upon, had an overarching aim at providing technology and innovative solutions in terms of the management of immunization certificates, with special emphasis on what's required in working on in areas with very low levels of connectivity. And again, that's the overarching challenge that we see in the Americas, where we still have heterogeneity in terms of access to connectivity and central elements and resources that could provide a much more effective digitalization effort. This innovation is based on international standards, as Mike Garland's already from PAHO mentioned, and the data that we generate with this innovation can be then used in a very straightforward and streamlined manner. As you know, the digital transformation in the health sector is one of the top priorities that we have in this transformation process that puts the health sector up to date after many decades of lagging behind. This is a key advantage. And this is a key constructive component to make a system of health more resilient that will better respond to the needs of our communities. The processes linked to this are not the exception. And this represents, first of all, the need to understand not just these processes as elements to improve specific operations and specific technologies, but all of this represents a much larger construct. And the immunization component is one of the key components in strengthening health overall, comprehensively, to increase the availability of information for sound decision-making processes, looking at traceability, the security of and quality of data in a strategy. That's also essential, and it contributes directly to protect the most vulnerable communities. And in the remote context or with structural issues of connectivity, we'll be able to ensure that we have continuity, efficiency, and equity in the services that we are providing and the decisions that are being made overall. And as a result, just to complement this effort, we've seen the development of a robust digital organization, not just as an innovation and technical component, but everything that's necessary to make this key change and transformation. This digital literacy program training will also help healthcare workers to give them the digital skills necessary in order to maintain these digital tools in a world that is increasingly digitized and in a sustainable manner as well. If we want to make sure that we have sustainable successes, then we will depend not only on technology where we can access this, but also the know-how as well as ownership and confidence that we're using this properly. Cooperation, a tripartite cooperation effort within CETA, PAHO, and the Ministry of Health of Peru has provided us with various valuable insights to see exactly how we can work in this very complex context, how to overcome some of the technical barriers that can impede sometimes cooperation, and how to build together mechanisms that can be adapted. And although we recognize, of course, these started in Peru, they have a universal value for all of the countries in the region. Thank you very much to the Peruvian government and the German Cooperation Development Agency for their support, and this will be implemented and made available to the entire hemisphere. This is part of a cooperation commitment and reciprocity that, of course, we always pay tribute to the pioneer country, Peru. But with improvements, we know that Peru will always be the first, the pioneer, with this focus on providing that catalyst and expanding this coverage. Let me also express special thanks and recognition Ms. Tessa Lenneman from the German Development Cooperation Organization for their commitment, trust in our team, and the entire team from PAHO, who has shown a very solid level of professionalism. From the Office of Intelligence and Evidence, we reassert our firm commitment where we will continue walking step by step on this program and guiding you through it. We will continue to document each step, and we will use this experience as a shared resource for the region. I also want to recognize the leadership of the Peruvian country office in Peru, the technical support units, Piedad. We know that this was a major teachable moment and learning lesson, and also wanted to highlight the interprogrammatic component, which is thanks to the coordinated efforts between the Office of Evidence and a smart immunization program. This element where we've prioritized it, where we've worked together on that, this articulation reflects the ownership, as well as the relevance. And I think we are now poised and ready to move forward as we roll this out. So let me reiterate our commitment to the project and reinforce the idea that the technical team is continuing moving forward and closely watching all of the future developments. And thank you very much for all of your support, and thank you for joining us at this event. Thank you very much.
Muchas gracias,
Thank you very
doctor
much,
García Saizó, por sus
Dr.
palabras.
Garcia
Tenemos
Sensot, for
rápidamente
your comments. And
conectada la doctora Maureen
we also
Birmingham.
have
No sé, ella
Dr.
estaba con una agenda un
Willingham.
poco apretada el día de hoy, pero
She
estaba
had a
escuchándonos.
busy agenda today,
Si
but she
no,
was
continuamos a
connected.
ver si es que ella puede volver a conectarse
We'll
para dar
see
un
if she
breve
can
saludo, pero
reconnect, if
continuamos
she
en
can
todo
share
caso con las
her
palabras
greetings with you.
del
But now
doctor
we
Hugo
continue
Rasuri,
with
gerente
Dr. Hugo
adjunto del Programa
Rasuri,
Especial de
who
Inmunización
is
Integral
the
de la
Assistant
OPS-OMS.
Director
Adelante, doctor.
for
Muchas gracias, Adriana. Y bueno, buenos días a todas y todos
Comprehensive
los colegas que
Health
están ahí
here with
reunidos y a
PAHO.
los
Good
que se
morning. Thank you
conectan
very
en
much.
línea a este webinario. Primeramente
And
quisiera darles el
I would like
saludo al
to
nombre del
share
doctor
with
Daniel
you the
Salas, quien es el
greetings
gerente
on behalf
ejecutivo del
of
Programa
Daniel
Especial de
Salas, who is the
Inmunización
Executive
Integral de
Manager
la
of the
OPS,
Special Program
y
Comprehensive
darles una
Immunization,
bienvenida a
and
este
welcome
webinario
you to
Innovación
this
en el
webinar,
registro de vacunación con soluciones
Innovation
digitales
in Vaccination
interoperables,
Data
el
Capture with
papel
Interoperable
del
Digital
papel al
Solutions
dato
from paper
digital,
to
y
digital data,
donde estamos revisando la
where
experiencia
we
con las
are
guías SMART
reviewing the
para
experience with
inmunizaciones de
the
la OMS
SMART
en el Perú.
guidelines for
También me
immunization in
gustaría transmitir
Peru
mi reconocimiento
based
y
on
agradecimiento
WHO
a los
guidelines.
colegas que están
I would also
acompañándonos en
like
esta
to
apertura, la
thank all the
doctora
colleagues
Piedad
who have
Huerta,
joined
jefa de la
us here
Oficina de Cooperación
today.
de Países y
Piedad
Regiones de la
Huerta,
OPS,
who
el
is
doctor
working
Cristian
with the
Vélez, muy
regional
buenos
offices,
días,
Dr.
director
Cristian
internacional
Vélez, who is
estratégicas
the
de salud
Director of
pública del
Strategic
Perú, y el
Interventions in
doctor
Public Health
Sebastián
from
García
Peru, and Dr.
Saizo,
Sebastián
quien es el
García
director de
Saizo,
Evidencia e
who
Inteligencia
is
para la
the
Acción en Salud de la OPS.
Director
Y
of the
también
Department of
extender
Evidence and
mi
Intelligence for
agradecimiento
Health
y
Action. And I would
reconocimiento al
also
equipo
like to
técnico que va a
thank and
presentar hoy
recognize
día
the
las
technical team that
exposiciones.
will be
Es,
conducting
es
the
un poco difícil
presentations. It
no
is a little bit
redundar en lo que muy
difficult
bien mis
not
colegas han
to
dicho
repeat what my
anteriormente,
colleagues
pero
have
bueno, creo
so
que hay
properly
algunos
said
puntos
before, but
que
I
todos
think that
ellos
there
han
are some
resaltado de la
comments that they
importancia
have all
de
highlighted, and it
esta
has to do with the
experiencia
importance of
y
this
esta intervención,
experience and
y
intervention,
cómo marca un precedente
and
regional, ¿no?
how this is
Es una
setting a
solución
precedent
diseñada
at the regional
realmente para
level. This is a
contextos en donde
solution
más se
for
requieren, donde más
contexts that
requerimos
are
que estas
in
innovaciones
need
lleguen,
for
la
these
naturaleza
innovations,
de uso offline en
the
el
nature
terreno,
of the offline
eh,
use in the
y cómo
field,
esta
and
experiencia no es
also how
solamente
this experience
una demostración
is not
puntual o un
only a
ejercicio
specific
interesante, sino es algo que está
exercise and
concebido para
display of
estos entornos
technology,
y que
but
puede
this is
ser
also that has
escalable a
been
otras regiones
designed for this
de,
sector and that can be
de la región de las Américas,
scalable
¿no?
to other
Él
regions in the Americas.
mencionaron mis colegas
My
anteriores
colleagues
el hecho de
that
usar las guías
preceded me
SMART. No voy a
mentioned the importance
repetir
of
eso,
using
pero
the
es algo que
SMART
también contribuye
guidelines.
a
I am not
reducir la
going to
ambigüedad,
repeat this, but I think that
estandarizar las
this also
decisiones y
helps with
acelerar la
reducing
ejecución de este tipo
ambiguity,
de intervenciones.
increase
Me gustaría más
standardization, and
bien
streamline
enfatizar
application.
en los
I'd like to
resultados
underscore the
medibles que hemos
results,
tenido al
the
evaluar esta
measurable
intervención,
results that we have had
particularmente, por
when
ejemplo, en
assessing
el tema
this
de la reducción
intervention, in
del
particular
tiempo, ¿no? Reducción de
in
hasta
time
30% del
reduction, up
ingreso
to
de los
30%
registros
of reduction
comparados
in
con los
entering
ingresos en
records as
papel,
compared
en
to
situaciones en
paper
donde estamos
records. And
enfrentando a personal que tiene
we
tiempo
are
reducido, que tiene que hacer
faced
acciones con múltiples
with
personas en campañas
staff
de
that
vacunación,
need to
puede ser
be that have
una
some time
diferencia
constraints, that
sustancial,
need
¿no?
to work with
El
several people on
incremento
the
en la calidad de
ground,
los
and this
datos
may
mediante las validaciones y
be of
alertas
importance, of
han
relevance, and
demostrado
also
que
the
previenen
alerts
duplicaciones y situaciones
also
como la
avoid
ilegibilidad
duplication
de
and
los
also
registros en
the
papel.
inability to
Y
read
ya lo
paper
mencionaban
records.
colegas, pero sí,
And our colleagues already mentioned this, but
recabado información
we have
importante como
also
la
collected
usabilidad de
information
esta
such as the
herramienta varía de acuerdo a las características
ability to
del
use
personal de
this
salud,
tool
que
based
es
on the
algo que es muy
characteristics of the
importante porque
health
ese es el
staff. And
escenario
this
donde
is something
tenemos
that is very
que
important because
desenvolver
this is
esta
the scenario
herramienta y
where we
tenemos
need to develop the tool
que trabajar con ello, ¿no?
and
La
we need to work with
capacitación
this
en ese
tool
sentido
training
es conveniente que sea de alguna manera diferenciada
should
para cada uno de
be
estos públicos.
differential
Por ejemplo, se ha
based on
notado que
the
el público
public. We
joven,
have
los
seen
trabajadores de
that
salud joven adoptan la herramienta con
young
ciertos recursos y ciertas
workers
facilidades
adopt the
que las
tool with
personas
some
que no han tenido de repente una
with more
exposición a
ease
medios
than
digitales
those
tanto, ¿no? Y
individuals that have had
esto es
not
parte de lo que tenemos que recabar
exposure
para
to this
poder
type of technology.
actuar en
And
ese
this is the
sentido.
type of information that
Resaltar
we need to
también
collect to
qué
work in
pasos
this area.
siguen.
We should
Entiendo por lo
also
que me
see
refieren los
what
colegas que han
steps they
estado
follow
involucrados
based
en este
on what I heard
esfuerzo,
from my
seguir
colleagues.
trabajando en la
We need to
interoperabilidad con
continue
otros
work on the
sistemas de información
interoperability
nacionales. Eso es algo
with other
obviamente que se
national
puede seguir aplicando en
information
el Perú, pero
systems.
también se
This is
puede
something that we
desarrollar
can
en las
continue to apply in
subsecuentes
Peru, but
aplicaciones
also
que
we
pueda tener
can
esta
use with
herramienta
other
en otros
applications
contextos.
of this
Esta
tool in
capacitación
other
diferenciada
contexts,
por
this
perfiles y
differential
obviamente seguir
training based on
entendiendo
profiles, and
y
we need to
trabajando en
continue to
cómo brindar un
understand and
soporte
work on
técnico
how
y
to
un
provide
mantenimiento a lo
technical
requerido para
support
que
and
este tipo de
also
intervenciones funcionen.
the maintenance we need for
Finalmente,
this type of
no quisiera
application to
terminar
work.
sin
I wouldn't like
agradecer
to
y
conclude
subrayar esto,
without expressing my
nuestro
appreciation
agradecimiento, valga la redundancia, a GIZ por el
for
apoyo
GIZ
y
for
su
their
compromiso en
support
este
and
tipo
also
de
for their
intervenciones y la
commitment
voluntad del
with this
trabajo
type of
conjunto con la
intervention and
Organización
also the
Panamericana de la
willingness
Salud
to work
y
together with
felicitar
the
al
Pan
Perú
American
por
Health
liderar
Organization. And I would like to congratulate Peru
esta
for
intervención de
leading
transformación
this
digital al
intervention
servicio de la
focused on
inmunización,
digital
que es fundamental. Si
transformation.
una herramienta ha sido probada en un
And if a
contexto
tool
como la
has been
Amazonía
proven in a
peruana,
context
es un
such as the
candidato ideal para
Peruvian
ser
Amazon
adaptado a
area, it
otros
is a
contextos
candidate to be
similares en la región,
adapted
¿no? La
to
invitación
similar
de hoy en ese sentido es
contexts
concreta,
in the area. So this is
observar
a
la
very
evidencia, vamos a
specific
escuchar
invitation. We
más
need to
sobre esto,
observe
discutir
evidence.
estos
We're
aprendizajes
going to hear more
y
about this.
seguir
We're going to
adaptando
learn
con
from these
criterio y seguir
lessons, and
midiendo
we
el
need to
impacto de
adapt
estas
this and continue to
intervenciones
measure
tan
the
exitosas.
impact of such
Muchas
successful
gracias.
interventions. Thank you very
Muchas
much.
gracias, doctor Hugo
Thank
Rasuri,
you,
por
Dr.
estas
Hugo
palabras de
Rasidi,
inauguración
for
del
your
webinar.
opening
Bien,
remarks
vamos
for
a
this
avanzar
webinar.
con la agenda
Now
que
we are
tenemos
going to
para
move
esta
on with
sesión
our agenda.
y vamos a arrancar con
And
la
now we are
presentación
going
del
to start with
aplicativo
the
digital.
presentation of the
Entonces,
digital
luego de estas
application.
importantes
So
intervenciones que evidencian
before
el
such
compromiso de
important
trabajo
remarks
conjunto
that
entre la OPS y el gobierno
show
del Perú,
the
vamos a
joint
conocer la
commitment of
experiencia de
PAHO
innovación
and
digital en
Peru, we
concreto
are
a
going to
través de la
learn about
presentación del
this
aplicativo
digital
digital para el
innovation
registro
by
de vacunación.
presenting
En esta
this
oportunidad vamos a darle
tool.
el pase al doctor José Enrique
And now
Pérez
we are
Lu,
going
director
to
general de la
give the
Oficina
floor
General de
to José
Tecnologías de la Información
Enrique
del Ministerio de
Pérez
Salud del
Lu,
Perú,
who
y
is the
también al
director
doctor Fernando
of the
Plazota, consultor
IT
de la Unidad de
department with
Sistemas de
Peru,
Información y
and
Salud Digital
also
de la OPS-OMS, quienes nos compartirán
the
desde
director
los roles
that
que
is
han
working with
tenido
us
estas dos
here
instituciones,
at
cómo
PAHO
fue la
on
experiencia del desarrollo
IT
tecnológico.
systems, who will share with
Entiendo que
us
empezamos con el doctor José Enrique Pérez Lu,
their
así que
experience.
adelante.
I think that we start with Dr. José Enrique Pérez Lu.
¿Cómo están?
Please go
Buenos días
ahead. Good
con todos
morning.
y con todas.
Good morning to all of
Un
you.
momento voy a proyectar mi
I am
presentación.
going to show my presentation.
Ok, listo. Bueno, ¿qué
Very
tal?
well.
Bueno, el día de hoy les voy a hacer la
Today,
presentación sobre el
I
desarrollo
will be
tecnológico,
presenting
cómo
the
las Smart
technological
Guidelines se
development and
aplicaron, digamos,
how we
para
applying
el desarrollo
the
del
SMART
aplicativo offline
guidelines
de
for the
vacunas.
development of the
Desde
offline
la
vaccination
experiencia que
application
nosotros hemos tenido
based
desde
on
la
the
Oficina
experience
General
that
de
we
Tecnologías
had
de la
from
Información
the
del Ministerio de Salud, ¿no?
Technology and
Que
Information
ha
Office
sido un
here in
trabajo
Peru.
conjunto con el
This has
equipo
been
de la
joint
OPS,
work
¿no?
with
Para poder
PAHO
desarrollar
to be able
este
to
aplicativo.
develop this application.
Bueno, de forma breve, ya se ha hablado bastante
Briefly,
de qué son las Smart Guidelines, pero
you
digamos,
already know what
la
the
OMS
SMART
creó
guidelines
las
are,
Smart
but
Guidelines para convertir las recomendaciones
WHO created
clínicas
the
en
SMART
herramientas
guidelines to
digitales que
convert
sean claras y
clinical
estandarizadas.
recommendations to
Estas guías
digital tools that
son
are clear
reutilizables y
and
adaptables,
standardized. These
lo que va a
guidelines
facilitar
can
su
be
uso en distintos
reused and
contextos, ¿no?
they can be
Y lo que
adapted
busca es apoyar la
for
implementación de
various
intervenciones de
contexts.
salud
And
pública en
the idea
sistemas
is to
digitales,
implement
sobre todo en
public
países
health
con recursos
interventions
limitados,
in
¿no? De
digital
forma breve, el
systems,
acrónimo de
particularly
SMART
in those countries where
significa que
the
estas guías son
resources are
basadas en
limited.
estándares, son legibles por
SMART means
máquinas, son adaptables,
standards-based,
son basadas en
machine-readable,
requerimientos y son
adaptive,
verificables.
requirement-based.
Estas guías dan la
And
indicación que hay que seguir
These guidelines have 5 steps for implementation of the recommendations. So we have followed all of these phases. We are currently working on the 5th phase. We have also completed the first phase, that is L1 to L4. L1 is the narrative. Here we have the traditional written medical notes, and this is the beginning of the sequence. The second phase, L2, is the operational phase, and we will finish here with the DAC, that is the digital adaptation kit. This is the adaptation of L1 to functional environments, and so that we can use any type of software. And the third, L3 phase, is machine readable. So we need to have recommendations with codes, interoperability, and medical technology to be used. So we are preparing the ingredients from the technological point of view so that L4 implements the recipe. These are the algorithms and they can be implemented with the software. At L4, we have the software. L3 are the ingredients. L4 is the interaction among the ingredients and how we translate this into software. L5 is the dynamic portion, and that is the use of information that we have collected through the application for analysis and decision making. Now I will be discussing each of the steps briefly, what we have been doing from the Ministry of Health for the implementation of the application. L1 is the narrative. This is the starting point of the SMART guidelines. Here we have the recommendations, and the technical standards were published as a text here in Peru. So we have readable text, written text based on evidence, and this will also be used as the conceptual base for the next stage. And with this, the technical teams will understand the clinical content. And as I mentioned before, this is the input for the next stage, L2, and the digital adaptation kits. For example, here we are going to have narrative text explaining the functions, and this is what has to be taken into account for each vaccine. For example, for the BCG vaccine, there will be a recommendation as part of a text, and that every single newborn receives the BCG vaccine within the first 24 hours of life, preferably within the health facilities, and also the pentavalent vaccine. Children receive 3 doses of the vaccine at 2, 4, and 6 months with a minimum time of 4 weeks in between doses. And then in L2, we turn all of the recommendations from L1 into operational information that can be implemented in the digital systems. This is the core of the system for the digital adaptation to work. What are we going to have here? We are going to have use cases, we have use stories that will explain how to apply the recommendations. We're going to have workflows, decision algorithms, decision trees. We're also going to have functional requirements, for example, data elements. What are we going to gather? We are going to gather graphs for vaccines, for example, and this will also allow developers and designers of the system to understand what the software has to do without any ambiguity. So in the case of use cases, we are going to have various aspects. We're going to have text, the local context, and also the role, the challenges, and this will be translated into a table where we're going to have the various use cases, and we are also going to have the identification of the processes and also who will be using this, and the use case, and also set of tasks for each use case that we have developed. We are also going to have a flow chart for the process and a dictionary that will be translated for the pieces of information to be used. And at the end of L2, that is the digital version, we are going to have different products such as the user history, the workflows, data dictionaries, etc. For the third phase, that is L3, this is the way we transform L2 components, that is the digital state, into structured instructions, and they are going to be understood by the digital health systems. So, for example, we are going to have what we explained yesterday. We are going to have a representation of the clinical data, the workflow, the decision-making network, and also the format, the technical format. And what is FHIR? This is a standard that will allow for various health systems to operate together. So this is by using a FHIR resource. These are digital Lego pieces that represent an administrative concept, and each has a structure or a clinical concept, and they can become more complex or interoperable. For example, we have a resource that is the patient, and this will include all of the demographics for the patient. We're going to have another immunization resource that will include all of the administered vaccine information, and then additional resources. In this system that we have identified, we have used 20 of these FHIR resources, and these are important. This is going to give us data exchange and also how to use the right terminology. This is also a point of reference for the database and what we need to use, and at the same time it will have the support of the collaborative work that we are going to do. And this is the preparation of the FHIR resources for the patient, for the care provider, and how this is related, for example, to the insurance, to the care provider, and also with the history or with the code, with the CIE-10 code. So for this, we need to train our staff, and also for this to operate with other projects. And for L4, this is the part that will be implemented, and this is how we turn L3 into algorithms that can be directly implemented in the software. So here we have a translation of the functions and how they were translated in the application. So for example, we can see that in order to go in, we needed to have double verification, and we needed to download all of the information. We need to remember that this is an offline application, so we need to have earlier information so that once we go to the site, we do have the information available for use. And once we enter the information of the patient, be it the ID, we need to have uploaded all of the information ahead of time and all of the alerts that we need for the health staff, and all of this has been translated into digital language. All of these recommendations or functions that were developed in L1, L2, and L3 shows us the ingredients that we are going to use, and also under L4. We are also implementing now L5 and how we are using this information for decision making. And to conclude, the SMART guidelines allow to transform clinical recommendations into standardized digital tools. So the ongoing application of the various phases that we have used for the immunization guideline of the Ministry of Health has turned into algorithms and also into information that we can use offline without the need to be connected to the internet. An offline application can apply automated clinical logic without depending on connectivity, and also the implementation of these tools creates a solid basis for future interoperability and population analysis. Thank you.
Muchas gracias, doctor
Thank you very
Pérez-Lu, por
much,
esta
Dr.
presentación.
Perez-Lu, for this
Antes de darle el
presentation.
pase
Before I
al
give
doctor
the
Fernando
floor to
Plazota, quiero
Dr. Fernando
recordarles de que
Plazota,
pueden dejar
I would
sus
like to
comentarios
remind you that you can leave your
sus comentarios en el
comments
chat y también
in the chat
sus preguntas,
and also
consultas
your
en el
questions
botón de preguntas y respuestas que
using
está
the Q&A
habilitado
button that
en
is
el menú
enabled
de inferior.
at the
Así
bottom of
que
the screen.
adelante ahora
So I
con
give
el
the
doctor
floor
Fernando
now to
Plazota,
Dr.
consultor de la Unidad de
Fernando
Sistemas de Información
Plazota,
y Salud Digital de la UPS OMS.
who is a
Bueno, muchas gracias.
consultant on
Es un
digital
honor poder
systems,
participar de este webinar en el que
and here at
tenemos la
PAHO,
oportunidad de
it
transmitir
is a pleasure to
y
participate
comunicar
in this
el trabajo que venimos
webinar where
llevando
we can
hace
share with you the work
prácticamente
that we
un
have
año y
been
medio, casi
doing
dos
for
años,
over
en
a
este
year,
proyecto
2 years
complejo, tan
now,
desafiante,
as
pero
part of
también
such a
tan
challenging
satisfactorio,
project, but something that is also so
digamos, poder
rewarding
comunicarlo en este punto.
to be able to share
La
this
idea
with you.
es simplemente transmitirles
The
que
idea
más
is
allá
to
de las complejidades
convey
técnicas
that
que
beyond the
mencionó recién el doctor
technical
Pérez Lu
characteristics
y las
mentioned by
definiciones
Dr.
estratégicas que
Perez-Lu and
fueron
also the strategic
mencionando en la
definitions that
introducción a
were
este
also
webinar,
mentioned
hubo
in
una
the
serie de
introduction
trabajos
of
que
this
como parte de la
webinar,
cooperación
there was
técnica entre
also
GIZ,
additional
OPS,
work
Ministerio y
that was
también
the outcome of the
algunos actores
cooperation
fundamentales
among GIZ,
fueron
PAHO, the
llevándonos en el día a
ministry,
día
and
a que
other
hoy estemos aquí.
entities. So that's the reason why
Empezamos
we are here.
hace algo más de un
We
año,
started
en
almost
abril,
a little
un
bit more
taller de
than a year
Marliner
ago in April
realizado aquí en
with
Lima,
a workshop that
en
we
el cual
had
no
here in
solo nos dio la
Lima.
oportunidad de que se
And this
conocieran los equipos de
gave us
trabajo,
the
sino que
opportunity not
además
only to have
ver
the
que esto que estábamos por
teams
empezar a hacer
meet
era
each other,
factible,
but
porque
also
vimos
to see
ejemplos
whether this was
de
feasible, because
otras
we saw
instancias,
examples of
también con la cooperación
of
de
other
GIZ,
approaches also
DITC
with GIZ
y Digital
cooperation,
Square, cómo estaban trabajando en
and
países de
to see
África
how they were
con
working, for
este tipo de
example, in
soluciones y el
Africa.
éxito que
We also
estaban
saw this
teniendo.
with
Entonces eso
OGTI,
ya
and
levantaba la moral de los equipos de trabajo
this
porque
was
tenían
really a
ejemplos
booster
tangibles
for
de que
our morale, the
estos
morale of our
aspectos finalmente funcionaban.
working
Luego de ese
teams,
taller
because
entramos
they
en una
saw that this
etapa
was
en la
actually
que
working. After
eh,
that, we moved
se
on to a stage
empezó a definir la factibilidad
in which we
técnica y
started
las
to define the
decisiones
technical
iniciales sobre cómo
viability,
debía
and we started
realizarse la
making the initial
configuración de esa
decisions as to
aplicación.
how
Más allá de
to
todo esto
set
que
up
presentó el
the
doctor Pérez Lu,
application beyond what
teníamos
Dr.
que
Perez-Lu presented.
terminar de definir qué
We
tipo
needed
de solución
to
era la mejor
finally
para el
define
Perú.
what would be the best
Entonces luego se
solution
hizo
for
una
Peru.
propuesta de ingeniería
So
de
then
software que
we
fue aceptada
presented a
básicamente por
proposal,
todos
and it was
los
accepted
involucrados, todos los
mainly by
stakeholders
all of the
y también los sponsors
stakeholders
que
and
teníamos
also the
en
sponsors
este
that we
proyecto.
had as
Y
part
esto
of
se
this
realizó de manera
project. And
colaborativa
this
entre todos los
was
participantes.
a collaboration
Se
among
definió cómo
the
se iba a estructurar,
participants. We
cómo
also
iban a
defined the
realizarse cada uno de
structure,
los pasos
how
del
we
L1 al
were
L5,
going to
cómo se
conduct
iban
each of the
a
steps
desarrollar,
and
no en el sentido
phases
de
from
las
L1
herramientas,
to
sino
L5,
en el
how
sentido
we were going to
funcional.
develop
Y
this
todo esto
beyond the
fue
tools
parte
and
de
more
las
looking
actividades
into the
que
functions.
se
And
fueron
this was part of
liderando
the
desde la
activities that
oficina
were
del
led
país en
from the
conjunto con
country office together
la
with
OGTI del MINSA.
the
Bien, no quiero
OGTI
dejar
with
de
the
mencionar
Ministry of
la
Health.
participación
And I would
de
like
la
to
doctora
mention the
Patricia
participation
Arce y José
of
Villanueva, con
Dr.
quienes
Arce and
logramos un
Jose
equipo de trabajo
Villanueva.
periódico para ir
We were
haciendo el
able to
seguimiento
create a
más allá del
systematic
equipo ampliado
work group
que fue
so
mencionado
that
por
we
la
can
Huerta.
we were able to work beyond what
Y a
Dr.
partir de eso
Piedad Huerta
nos
mentioned at the
fuimos
beginning.
encargando de todo lo que
And
era la
then
definición de un equipo de
we
trabajo, la gestión del
defined
capital humano para lograr un
the
trabajo
team that would be
exitoso y
working on
conseguir
this.
los
To
recursos
we
encargados de
manage
cada
the
uno de estos pasos
human
que
capital. We
presentó
also
el
obtain
doctor Pérez Lu
the
y sobre todo
resources that we saw in
consensuar
each of the
una
steps
agenda
that
de
Dr.
trabajo
Perez
para
Lu
poder llegar en
presented, and
tiempo y
also
forma
we
al
agreed
desarrollo de este
on an
aplicativo en los
agenda
tiempos
to
en los que estamos
develop this application
que habían sido definidos.
as
También hubo
defined.
que realizar
We
todo lo que fue
also
la
needed
evaluación
to
de la infraestructura. Y respecto de
focus
la
on
cooperación
infrastructure.
técnica,
And as to technical
básicamente para
cooperation,
lograr estas guías de
basically to
vacunación que
attain
mencionó el
these
doctor Pérez Lu, fue
vaccination
necesaria la
guidelines that
participación de
Dr.
expertos
Perslu mentioned, we had
de
the
OPS,
participation of
el equipo liderado
PAHO
por la doctora
experts, the
Velandia,
team
en la
led
cual
by
no
Dr.
solamente se
Velandia,
revisa la guía local, sino
whereby
también
we not
se
only
valida con las
reviewed the
guías
local
internacionales.
guideline, but we also
Luego,
validated
cómo
it with
estos
international
Digital
guidelines, and we
Adaptation
also
Kits
saw
o los
how
kits de
these
adecuación digital de
digital
la guía narrativa a
adaptation
la guía
kits
plana
would
o en
provide the
formato tabla
narrative to
también
the
hubo que
flat
revisarla, también hubo
guideline,
que adecuarla.
and
Y
we
estos también
needed
fueron
to adapt
trabajos que
this, and
tomaron
this
tiempo
was
previo incluso
a
a
task
el
that took some
desarrollo de la
time
aplicación.
before
Hubo que
developing the
conformar
application.
equipos de trabajo
We
para
also
cada una de
needed to
estas
create
etapas,
work
el
teams
L1 y el
for
L2,
each
que
of the
eran
stages,
más que nada
L1 and
trabajos
L2,
sobre
and this was work
guías, trabajos
on
sobre inmunizaciones, y el L3 y el
guidelines and
L4, trabajos
harmonization.
más
L3
técnicos,
and
más de
L4, we
desarrollo, más
had
de
more of a
conocimiento.
technical
Y ahí
work,
nos encontramos con un
development,
problema
and
y era que
knowledge.
las Smart
And then we
Guidelines,
had
si
a
bien son una
problem.
solución moderna,
Even though
novedosa
these
y
are very
tecnológicamente
new solutions that are
superior a lo que muchos conocemos,
technically
eso la
sustainable,
ubica en un
this
lugar que
places
carecemos
it
de
in an area in
expertos.
which we have no
Entonces,
experts.
tuvimos
So
que contar con el apoyo
we needed
de
to
expertos, que
have
fue la
the
empresa ONA, que
support
había
of
sido presentada
experts,
por GIZ en el primer workshop
and this
y
had already been presented
nos
by
dieron soporte para
GIZ
esas
at the
definiciones
beginning, and
iniciales,
they
pero
presented us
también
some
organizamos un workshop hace
support,
casi
but we
exactamente un año
organized a
aquí en
workshop
Lima
almost exactly a year ago here
sobre
in
cómo
Lima
utilizar el
on
estándar
how
FIRE
to
para
use the
desarrollar
FIRE
este tipo de
standard to
soluciones
develop
complejas
this type
y
of complex solution,
lograr un equipo de
and
trabajo
also to
colaborativo con el
have
equipo
a
del
collaborative
MINSA
work
y el
team
equipo que había
that
sido
would work
proporcionado
with
por,
the Ministry of
o
Health and
mejor
the
dicho, gestionado
ministry
por
that had
OPS para
been
hacer un
managed
trabajo
by
colaborativo presencial.
PAHO to work on
Y
this
por
key
último, no dejar de
cooperation.
mencionar que
And
todo esto
finally,
también pudo
I
ser
need to also
llevado a
mention
cabo
that all of
gracias
this
a que
was
se adquirió
feasible
infraestructura
because
para este
infrastructure
proyecto.
was acquired for this
Servidores
project.
que obviamente no
We
voy a
have
entrar en detalles de cómo
servers, and
fue
I
el
am not
proceso,
going to give you
pero que hubo
detailed
que
information
definir y
as to the
adquirir
process, but we needed
y
to
que dan
define,
sustento a
acquire
todo
the servers
este
to support
proyecto, además
the
de los
project, in
smartphones que
addition to the
finalmente son los que se utilizan en los
smartphones that are
puntos
the ones used
de captura. Así que,
at
bueno,
the
finalmente,
point where we capture
luego de
information.
casi dos
Finally,
años de
after
trabajo,
almost
hoy
2 years
podemos estar
of
haciendo esta
working,
presentación. Decía,
this
muchas
is
gracias.
now possible to make this presentation to all
Muchas
of you.
gracias,
Thank you very
doctor
much.
Fernando Plazota, por
I
esta
thank you, Dr.
presentación.
Fernando Plazota, for
Quisiera
this
resaltar que
presentation. I
tenemos
would
ya
like
más
to
de
underscore that we have more than
280 personas conectadas, 287
280
me parece.
participants, 287.
Recuerden que pueden dejar sus
And please
comentarios en el
remember
chat,
that you
quizás
can leave your
podrían
comments
decirnos
in the
desde dónde
chat,
se están
and you
conectando.
can probably
Y
share
si
with us
tienen
where you are
preguntas,
connecting from.
pueden
And
hacerlas
if you
a
have any
través del botón
questions, you can
de
use
preguntas y
the
respuestas que
Q&A
está
button
habilitado en el menú
that is
inferior
enabled at
del
the bottom
Zoom.
of the screen menu.
Bien, ahora que conocemos el aplicativo
Now
en
that we are
cuanto a su
familiar with the
desarrollo
application
tecnológico, le
as
damos
to
el
its
pase a la
technical
licenciada Magdalena
technological
Rosales
development,
Dupuy Izarra,
we
directora
give the
ejecutiva de la
floor to
Dirección de
Magdalena
Inmunizaciones del
Cuepoy
Ministerio de Salud del
Izarra,
Perú,
who is
quien
the
compartirá con
executive
nosotros la
director
experiencia
with
del
the
uso del
Ministry
aplicativo
of
en el
Health of
terreno.
Peru,
Adelante,
and who will
licenciada.
share with us her experience in using this application. First, I would like to send my greetings to the Minister of Health of Peru because of such a significant for such significant progress made, and also for thinking of all of us when we developed this application. The immunization app was definitely a challenge for our country. It was a little bit difficult to work on this in the field. We had to overcome some barriers, not only time barriers, but also the right spaces, and also include the and work with the natural barriers. This was used in the Amazon area of Peru, and the record in Peru is based on the vaccination information, and sometimes we do it as part of the electronic clinical data that we have available, but clearly also the health facilities, health clinics do need connectivity to internet. They send that information and it gets to the ministry. And also some of the processes are conducted manually on paper, and we do need the cooperation of staff that enters this information so that we can upload it to the Ministry of Health system. When we're talking about remote areas in the Amazon area or border areas, that information usually goes to the specific point where the information is processed and then entered into HIT MINSA, that is our health information system. Thinking of them and also thinking of our nurses and given these difficulties, this application has been a valuable opportunity, and we chose the border areas in the Amazon areas, Loreto, Madre de Dios, and we implemented this period in 22 prioritized areas, bearing in mind their characteristics. Is there a problem? That had to do with connectivity to be able to have information used for decision making for the patient, and also for that information to make it to us to be uploaded. This was a great challenge, and we uploaded all of the information. We started all of the informal work, as Dr. Persu mentioned. We worked with our engineers, and there was a pilot test in Lima East, and we selected two health facilities, the Jicamarca and the Alto Peru facilities, and this gives us the idea of what the difficulties were in the area with the application, and we had the ability to improve this, and we worked together with the technical immunization team and our office and PAHO to be able to find a solution and have the pilot be the best version of itself on the territory.
After gleaning these observations, then from 26th of April, 26th of May, we visited all of the regions that have been selected, Madre de Dios, Amazon, and Loreto, because we believe that the IT education had the support of at least 50% that understood the use, the importance of using this throughout these jurisdictions. This was a major challenge because the technical team, both in immunization, they traveled to these locations and they visited all of the establishments that we're going to identify now. In the Amazon region, where we rolled out the staff through the provinces of Chapoya. So we included all of those responsible with the Renipre and all of those that know the Amazon region and Loreto. We also provided training and looked at the border areas that I'm sure you've heard about, Madre de Dios and Puerto Alegría, Cabo Pantoja. And in Madre de Dios, we implemented this in these four priority areas, Sonene, Puerto Pardo, Palma Real, Jorge Chavez, where we again deployed the immunization team. We had Dr. Patricia, who accompanied us in this addressing this challenge to get a better understanding the key limitations in these locations and to see how our health workers viewed many of these situations and challenges. The training, on-site training played a crucial part so that personnel could understand why it was so important to undertake this digital transition, especially in the prevention and control of disease in the indigenous Amazon regions, the importance of including our national schedule with the technical focus and ensure that this, and of course, our technical team made sure that these apps be clearly understood, the importance of the alerts for the app offline related to the vaccine schedules are scheduled, incorporated into this framework, providing also a presentation of safe immunization that was enshrined in the use of the app offline. We developed the proper flow chart for the correct use of this app offline, the verification of the users of the app offline, and the presentation for all of the health facilities. So we focused on these key outcomes, and for us, the provision of services, immunization services in the health facilities, that practice was clearly reflected, and we wanted to thank the immunization team and the benefits of the app offline reduced the wait time and also improved the records for the Ministry of Health. This reduced the risks of errors in digitizing the records that has a direct impact on health and administrative personnel. And this interoperability with the MINSA systems, we were able to reduce the risk of programmatic errors due to alerts relating to the vaccine process. And it also enabled the recording of vaccines applied the same day, avoiding the dual efforts in terms of the registration. We highlighted the importance of in-person training. This was very important, in-person on-site training to personnel that will use these essential elements for ensuring the adequate and effective use of technology tools. Communication will continue and be bidirectional with the teams, facilitating identification of opportunities to improve the optimization, the permanent optimization of these efforts. Health personnel have, in the area of immunizations, have shown a very receptive and positive and favorable reaction to the implementation of these new technologies, where they recognize the potential for optimizing and facilitating the development of the day-to-day activities of these professional intervention. We are now dreaming about digital transformation. Our dream is to move away from paper records, and we think about each one of the professionals and technical staff that accompanied us throughout the process to ensure that this app will break new barriers and new barriers and create new opportunities. I want to thank the immunization team, and we are now moving on to a new phase to ensure that this will be equally shared by everyone in our country. Thank you, Dr. Kepui. We see that there are some questions in the Q&A box. We can start responding in the chat box. That'd be great. Dr. Perez Luas is already responding to some of the questions. We can see in the chat we have people from Bolivia. We have some people from Trinidad and Tobago. Welcome to all of you. Thank you for joining us. Let us now continue with the presentations. Now, we have Dr. Marta Belandia, the Office of Monitoring and Evidence in Immunization at PAHO, is going to provide us a comparative analysis based on her experiences in Peru. Go ahead.
No la escuchamos todavía.
We can't hear you, doctor.
Ahí sí, ahora sí.
Now we can hear you.
Vale, adelante.
Yes, go ahead. Thank you for offering the opportunity to share these results of this analysis, this comparative analysis. The key aim
un segundo porque ahora no me está pasando. Hablando de tecnología, suele suceder.
Talking about technical difficulties. Don't worry, doctor.
Mientras tanto, les recordamos,
In
por
the
favor, que pueden
meantime,
dejar
we'd
sus
like to
consultas
remind
en la
everyone
sección
that
de
you can
preguntas y
post
respuestas
questions
y
in the
también
Q&A
por
box,
el chat
and
desde
also
dónde
you
se
can
están
comment
conectando para
on
saber
the
un poco
chat.
más
Just tell us
hasta
where
dónde
you're
está
from.
llegando esta información.
We want to know exactly where the information is, who we're actually connecting with.
Bueno, entonces voy a
All right,
hacer un plan B, que es
I'm moving on to Plan B.
con el, sin, a ver, share.
Doctora Marta, si gusta, yo puedo proyectar.
Marta,
Por favor, mil gracias.
I can put the presentation up.
La que dale, mil gracias.
Go ahead. Thank you.
Como les decía, pues ahora les vamos a
As I said
presentar
earlier, now we're
los
going to
resultados
present
de este
the
último
results
componente, que
of
era
this
queríamos
final
ver
component.
cómo se comportaba
We were looking
o cuál
at
era el
the
comportamiento. Pasamos adelante, exacto, la que sigue. Exacto. Entonces,
all right.
lo que queríamos en
What
con este
we wanted,
análisis
our
era
focus in this
determinar el
analysis was to
desempeño.
determine,
La anterior, pasa objetivos, por favor.
if we can go back one,
No sé a dónde mirar. Era mirar cuál era el desempeño de
we
la
wanted to look at
herramienta
the
y
comparative
compararlo
performance
contra
level
lo que
of
había
the
en el
tool
terreno, que
and
era el
compare
papel, ¿cierto? Ese era nuestro
to
objetivo principal
paper
y lo
records
queríamos
with
mirar
the staff
específicamente en
on
tres
site.
frentes.
And we
El
wanted to break
primero
it down into these three
era
components.
la
The first
eficiencia
was
operativa, es decir,
to
queríamos
ensure
ver
or
cuánto
look at
tiempo se
operational
invertía en uno y
efficiency.
en
We
otro.
wanted to know
Luego,
exactly how
identificar
much
la
time
calidad de
was
los
invested in
datos,
each
ver
alternative. Number
cuál
two, identify the quality of
facilitaba o
data
favorecía que tuviera
collected
una mejor calidad de los datos
and
a través de ambos
what
métodos.
were the
Y por último,
advantages of
explorar la
both
percepción
methods.
de
And
las personas que estaban usando.
thirdly,
Pasamos la siguiente,
explore the
por favor.
perception, exception, and
Para
usability
ellos, ¿qué
of
hicimos?
the app. So
Primero
what
que
did we
todo,
do? Well,
se
first of
hizo
all,
un estudio transversal
we
mixto
conducted a
aplicado en
combined
replicar la
cross-cutting
adaptación que se iban
study
a llevar a cabo
that was
en las zonas
applied by the
indígenas
vaccine
del Perú,
teams
en
in
Loreto,
the
Madre de
Amazon
Dios y Amazonas.
indigenous
Como
regions
les
of Peru,
decía,
Loreto, Madre de
comparamos
Dios, and
registro en
Amazon,
papel
the Amazon region. We compared paper
contra el
records
aplicativo offline,
vis-a-vis
específicamente en tres áreas: el
the
tiempo, los
digital
errores y la
offline
percepción del
app.
usuario.
We looked
Y
at the
para
time
ello
invested,
hicimos
errors
30
committed,
encuestas a
and
los
user
brigadistas que están
perceptions. Then we
acompañando estas
distributed
actividades y
surveys
analizamos
among the 30 of the
409
members of the
registros
teams.
digitales
We
y
looked at
329
429
papel.
digital records
Para ello,
and 329
registramos los
paper
tiempos
records.
de cada una de las
So we
actividades,
looked
se
at each one
midió
of the
la
time frames of
coherencia
each
de los
activities,
datos,
and
luego se
we looked at
hicieron
the
algunos tipos
consistency
de
of the
análisis,
data.
como por
We
ejemplo
conducted some
el de
specific
correspondencia
analyses,
múltiple y el de clúster,
looking at,
para
for example,
perfilar a los
clusters,
usuarios,
in
para,
order
como
to,
lo comentaba un poco
as
el
we
doctor
indicated
Rasuri al
earlier,
principio,
as
para
Dr.
identificar
Rasuri
quiénes,
mentioned at the
cuáles eran las
beginning,
características de las
to mention,
personas que
identify what
estaban
were the characteristics
utilizando
of those who were
nuestro
using the
sistema y
profile
sus
of
opiniones.
those that were using the
También se
system. We wanted to
utilizaron
get their
métodos robustos para
feedback.
poder
There were robust
verificar que estas
methodologies in
comparaciones
order to
eran
determine
válidas. Se utilizaron
whether these comparisons were
gamma para
valid.
ver cuál era
Looked at
la
also
validez la validez estadística de estos
the
datos. Y
statistical
para las
validity
entrevistas
of
abiertas
the data.
utilizamos
And for
técnicas
these
de
open
inteligencia artificial
interviews, we used
para poder hacer los análisis de esto. Pasamos a la siguiente.
AI for
En esta
the
primera
analyses.
diapositiva vemos la
In this
eficiencia
first
operativa.
slide,
Vemos cómo
we see
definitivamente
operational
estamos ahorrando
efficiency,
un 30%
how
del
that was
tiempo
measured. We were
en,
actually saving
registrando en el aplicativo offline
30% time. It
comparado
was
con
30% quicker
registrar en papel.
in
Pero
terms
no
of
solamente había una
digital
eficiencia en el tiempo,
records
sino
as
como
opposed to
ustedes
paper
pueden ver
records.
en la
Not only
gráfica,
efficiency in terms of time saved,
el
but as you can
rojo,
see in the
en la
chart,
gráfica, la veo ya,
the
ahora sí.
highlighted
En la
red
derecha,
area
gracias, tengo un
to the
problema de derecha
to
y
the
izquierda.
right,
Como pueden ver en la gráfica de la
as you can
derecha,
see
el rojo
on
está
the
un poco
chart of the
más
right, the red
concentrado, mientras que el
is a much
azul, que
more
es el papel,
concentrated,
está un
whereas
poco
the
más
blue
desagregado.
paper records is
Esto
much
habla
more
entonces de que
disaggregated.
también hay menos
So this
dispersión
means
en,
that there's less
en el sistema offline.
inspection in
Pasamos
the
a la siguiente.
offline system.
Aquí, en la siguiente,
So
vemos
here
entonces la
we
comparación por
see
cada uno de
the
los sitios.
comparison by
El número
each
nos muestra el
location.
tiempo
The numbers
promedio
tell us the average amount of
del
time
registro en papel y del
of paper
registro en la
records
aplicación.
as
El
opposed
color
to
representa cuánto
recording
tiempo se
using
demoró.
the
Y
app.
aquí podemos ver
The time, the
que
color is
teníamos
reflected in the
diferentes, que
time
pasaban cosas
we saw different things going on in different locations. We could see how in Santa Rosa and Concordanqui took less time, but in Jorge Chávez, which is the dark blue shade, paper, people preferred to use paper records as opposed to offline app. So it means that each target audience is different, and we have to respond to each one of our target communities. The second focus, specific focus, was looking at data quality. So we could determine that there were fewer errors. This was validated that with the multiple matching, we were able to see, we were able to segment the users. And here we can see in this chart how some of the characteristics of the system enabled the users to feel more comfortable and felt the information was reliable. In the first slide, or the first side, we can see how users had greater confidence and trust. In the majority of the users believe that the offline app, it was much more straightforward and they trusted more in correcting the errors of the app. In the other chart, we see one of the characteristics of the system, which was that it allowed them to validate the data before storing it. And this helped increase the level of reliability and confidence that this was very significant sources of information.
Also, the alert strengthened trust. So whenever they saw an alert, they said, oh, I'm doing something, something is going on, so I am going to see what's going on. So all of these system characteristics allowed them to trust the quality of data better. They were able to validate data. They were able to correct mistakes, and also because alerts told them something is going on. And we also did the following. Here you can see 6 different panels with word clouds. Those panels, for those panels, we asked users to share words with us, like what were the problems with timing? What is it? What were the things that actually had an impact on the timeline? For example, patient, app, data. So we see this everywhere. This clearly helps them. This can facilitate the process. And we also saw the word internet and connectivity that clearly facilitated or made it more difficult, or made the process more difficult. And here we saw some suggestions to improve infrastructure and also to make sure that connectivity was working. This slide is too small, but here we profiled the users. We got to see who was using the app, and we found 3 types of users. The ones in the first cluster, the first column, usually the first row, that rather, these are young women that trust the system significantly. These are young individuals who are well adapted to the digital system, and they easily adopt it, and they agree with the strategy, they work with it, and they are completely willing to continue to digitize the system. Here in the second segment, we have a mixture. We have men and women who have limited access to internet. They belong to generations that had less ease of using internet and digital technologies, And
Era un mundo
therefore,
nuevo, o sea,
this was a new
querían
word for them.
participar, les parecía
They
interesante,
wanted to
pero
participate. They thought it
necesitaban
was
más,
interesting, but
más
they
trabajo,
also
¿cierto?
needed
O
to
sea,
work more on
necesitaban
this.
más refuerzos
They needed
logísticos, asegurar que hay
more
internet todo el tiempo.
logistics
Entonces, este era
support
el segundo
just to
tipo de
make sure
persona.
that internet was
Y
available
el
at all
tercer
time.
segmento, que es el
And the
Cluster
third
2,
segment, that is
ahí
the
volvemos a tener
second cluster,
heterogeneidad
once
tanto
again we
en
have
sexo como
heterogeneity
en grupos de edad.
in
Este
terms of
grupo
the age
no
groups.
confiaba mucho en el
This
sistema.
group
Tenía
did
una
not trust the
confiabilidad media
system.
o baja,
They had
pero al final querían también participar.
they didn't trust the system very well. So,
¿Qué es lo
but they
importante
wanted
de
to
esto?
participate. So,
Que
what is
esto nos deja
important
ver
here?
que en este tercer grupo, en el
Here
Cluster
we
2,
see
vamos a
that
tener que trabajar
with the
mucho más
second
en
cluster,
cambiar
we
el
will
chip,
need to work
en cómo
more
hacemos
and
para
change
adaptar
the
mejor
way
la
we
tecnología para que estas
adapt
personas
technology so that these individuals can
adopten más
actually
fácilmente.
use it
Y creo que en ese
more easily.
sentido,
And
el
I
curso
think that
digital, el
the
curso que vamos a lanzar
digital
esta tarde,
course
va a
that
ser
we
una
will be
buena
launching
respuesta
this
para
afternoon
las
will be a
necesidades que
good
tienen estas personas.
way to
Entonces,
address the needs
otra
of
vez,
these individuals.
este análisis comparativo nos
This
deja entender mejor
analysis
las diferencias
allows us to better
entre las personas.
understand the differences.
Finalmente, en el tercer objetivo,
Finally, as part of the third objective,
siguiente.
and now
Yo la
we're
paso en
moving
mi
on to the
computadora.
next one. I
Finalmente,
can
los resultados en
do it.
aceptación y usabilidad.
So
El sistema tuvo una muy alta aceptación. El 85% de las personas aceptaron el sistema
85% of the individuals
y la
accepted the
gente quería
system,
usarlo,
and people wanted to use it. As I mentioned before, they were highly interested
seguir trabajando con el
in
sistema.
continuing to work with the system.
Reportaron algunas barreras,
They
como les estaba
also
mencionando, las barreras técnicas,
overcame
de
some of the
sincronización de energía, pero
technical
también muchos
barriers, the
aprendizajes. Pasamos
alignment
la siguiente.
barriers, but also learning.
Y aquí vemos las
Here
nubes
we
de
see
palabras otra vez para
the
aceptación y
clouds
usabilidad.
with words in
Vemos nubes de
terms of
palabras
the
como vacunas,
use.
paciente,
We
si
see
podemos,
vaccines,
si podemos
patients, we can do
vacunar,
it,
pero
we
también
can
pudimos encontrar
vaccinate,
algunas
but we
barreras.
were
Otra vez,
also able to
aquí
find some barriers. Here
apareció
again,
el tema
we
de la
see
sincronización de
the
los datos y la necesidad de tener
synchronization of
ya
data and
fluidos algunos
also
datos, como por
how
ejemplo los datos del
to
padrón nominal,
have some
¿cierto?
part of the
Entonces,
information from the nominal record
también
already
el tema otra
updated.
vez de la conectividad
Once again,
intermitente
we
fue
have the issue of
identificado
connectivity that was not
como una
solid,
barrera en
and this
términos
was
de
identified as
usabilidad.
a barrier in terms of the
Pasamos a la siguiente.
ease of use.
Finalmente,
Finally,
¿cuáles son las implicaciones y el valor
what
agregado
are the implications
de
and the
lo que nos muestra este análisis
value
comparativo?
added that we see
Definitivamente, primero que
based
todo,
on
nos
this
demuestra que sí se
comparison?
puede,
First,
que
we
podemos
see that it
llegar
is
a
possible that
esas
we
áreas
can
donde siempre
get
nos han
to
dicho que la
those
conectividad no
areas
se
where we
puede,
always
que
heard
la
that
energía no se
connectivity is
puede,
low, that
que no se puede. O sea, sí se puede.
it is not
Perú
possible. It
demostró
is possible.
en las zonas
So
más alejadas del país
Peru showed
que
this in the most
digitalizar los
remote
registros
areas,
en
so
esas zonas es
digitizing the
posible,
records
es
there
viable.
is possible.
Y como
It is
ustedes vieron,
feasible.
mejora
And as you
el
saw,
tiempo,
this also improves
mejora la calidad de datos y fortalece la
timing, data
oportunidad. Y esto
quality,
es
and
clave en estas
strengthens this
poblaciones
ability
donde
to do
uno
so.
va por
And
una
this was
lancha
in
y no es que uno
particular
tenga todo el día
in
para ir y
areas
volver,
where
¿no?
one
O sea,
has to
tiene
use a
que
motorboat
asegurar
to get
poder
there,
cumplir
and
con los
you
tiempos
might not
porque
have
la
all the
gente está
time in the
esperando que
world to
lleguemos
get
al
there. You
siguiente, a la
need to
siguiente
comply
costa.
with the deadline
Entonces,
because people are
esto
waiting for us
favorece
at
el
the other side
tema
of the
de la
coast. So
oportunidad.
this also makes it
Luego,
easier.
en recomendaciones,
And under
las personas
recommendations,
nos recomendaron escalar
we were asked to
esta solución a otros territorios, ¿cierto?
take these
Que
solutions to other
que nos va a permitir
territories
optimizar la
so that
sincronización,
we can
garantizar
scale this. And
que necesitábamos, optimizar la
we were told
sincronización.
that we
Y en
needed to
ese sentido, lo que
optimize
hablaba antes, que la idea es que puedan, a
systematization
la
and
hora de tener
synchronization so
la app,
that
poder ya tener
when the app is
subida
available,
la
they can
información, por
also
ejemplo, del padrón
have
nominal,
all of
¿cierto?
the
Para que ellos de una
information
vez pudieran
uploaded
ver
from
esto.
the nominal record so that they could
Poder
do that,
garantizar
and also to be
respaldos
able to
permanentes
guarantee
y algo muy importante que también nos dijeron, reforzar la formación
backups,
continua.
constant
Otra vez, el curso puede
backups, and
responder
also
que
training.
necesitamos seguir
They
trabajando
said the
para
course
que la
may
gente
be
entienda mejor cómo
a
funciona
good
el app
idea, but we
y
need to continue to
seguirlo
work with
diseminando.
people for them to understand
Finalmente,
how
creo que
the
para
app
todos
works. Finally,
esto es una verdad de
I think
perogrullo.
that this
Eh,
is
esto va a
a
ayudar a
given,
cerrar las
but
brechas.
this will also
La
help
digitalización de la
overcome
salud
the
pública y la
gaps,
digitalización de la
and
inmunización
digitization in the area of
puede
public health
ayudar a abrir brechas
might
o
be
ayudar a
helpful
cerrar
to
brechas.
open
Entonces,
gaps or
aquí
to
podemos ver cómo digitalizando
close some of
o sea,
these
usando
gaps.
esta app,
So by
podemos cerrar
digitizing
brechas.
through the app,
Podemos
we can
hacer que las
close
personas que
some of
están más
these
lejos,
gaps.
que
We
más
can have
necesitan
those that are in
que más
remote areas
necesitan
and that need
un esfuercito para que trabajen mejor,
an effort
lo pueden hacer.
to work
Entonces,
better,
la idea es poder
can actually
cerrar esas
see a
brechas
result,
y
can
esta app
actually see that this is
contribuye a cerrar
feasible.
esas
We
brechas
can
de acceso a la
overcome those
información
gaps and
oportuna.
all
Y
that have to
obviamente,
do
como lo
with
decía el
timely
señor
access
ministro,
to
esto es
information. And as
fundamental
the
para tomar
minister
acciones
said, this is
oportunas.
key
Porque
to
otra
make
vez, el tema es que uno
timely
va por un río
decisions.
y entonces
Once again,
no es que hoy le pongo
when
la
we
primera
are
y venga en un mes o 2 meses por la segunda.
when
No,
we need
voy
to
por
reach
un
a
río y después quién
patient
sabe cuándo vuelvo a hacer
by
la
using a
llegada
river,
de
a
ese
boat
lugar.
in a river,
Entonces,
then, well, how am I
obviamente,
going to
esto nos
do and go and
permite tomar
administer the
acciones
first and second dose?
inmediatas,
So
tomar
with this, we
decisiones
can
y
make
apoyar a los
we can make
trabajadores a que hagan
decisions
mejor su
immediately
trabajo.
and also
Entonces,
support care providers so that they can do a
solamente
better
agradecerle al Perú,
job. Once again, we'd like to thank
doctor
Peru,
Pérez Lu,
Dr. Perez
doctora
Lu,
Magdalena, todas las
Mix
personas que
Dr.
están en el
Magdalena,
Perú aquí, del Perú aquí,
all of
agradecerles
the
muchísimo
participants from
por
Peru. We'd like to
brindarnos
thank you
este
deeply for
conocimiento.
sharing
De
with
veras
us
que
this
les agradecemos
knowledge.
muchísimo
We
todo lo
are
que estamos aprendiendo con ustedes
highly appreciative of
en este
everything we are
trabajo y
learning with you
como lo
as part of
decían
this work. And
los
as
panelistas anteriores, la
we
hoja de
heard
vida
it
está
from
aquí,
previous
siempre con
panelists,
ustedes
Pajo is
para
here, always with you
apoyarlos
to
en
support
lo que
you
ustedes requieran. Muchas gracias.
with your needs. Thank you very much.
Muchas gracias, doctora
I
Velandia,
thank
por
you, Dr.
su
Velandia,
presentación.
for your
Ya
presentation.
estamos llegando a la
We are
parte final del
getting
webinar.
to
Vamos
the
a
end of
pasar
our
a responder
webinar.
algunas
We are
preguntas que se han
going
hecho
to
con
answer some of the
la sección de
questions we
preguntas y respuestas del
received
chat. Todavía
through
pueden
the
hacer algunas si
Q&A
es que lo desean.
button. You
Voy
still
a leer las
can ask
preguntas
some
que
questions.
ya
I
han
am
sido
going to
respondidas,
read the
pero para
questions. They have
darle la
already been
chance a los
addressed,
ponentes por
but
si
so that I
desean
give
explayarse
the
un poco más
presenters
en
to
esa
offer any
respuesta, ¿no?
additional
Por
comments that
ejemplo,
they may
Osvaldo
wish to.
Chuquicoma Fermín
Osvaldo
pregunta,
Chuquicoma Fermin
buenos días, ¿qué
asked,
metodologías
Good
de
morning.
desarrollo se han
What is
aplicado en la
the
construcción del
development
aplicativo? Ahí
methodology
el
that
doctor
has
Pérez
been
Lu ya había
used in
respondido,
the
pero le podemos
development
dar
of
el
the
pase para que
application?
pueda
Perlu had
repetirlo
already
para que quede muy
answered, but
claro.
he can again share his
Bueno,
answer.
como ya he
As
colocado,
I
digamos, en el chat,
already mentioned, as
nosotros
we already
ya
mentioned in
tenemos,
the
por ejemplo,
chat,
una directiva,
we
¿no? Una
have
normativa en la cual
a
establecen las
guideline
diferentes metodologías que
to
se utilizan
establish the various
para el desarrollo de los
methodologies
software,
that we
¿no?
use for the
Entre ellas
development
está,
of the
digamos, las
software
metodologías ágiles, ¿no?
that
Que es el Scrum. Y también
includes
tenemos
Scrap,
ciertos
and
estándares, bueno, el
we
estándar
also
ISO
have the
29110 que lo
ISO
utilizamos para desarrollar cualquiera de los aplicativos
290 that
en
we
el que
use
desarrollo, ¿no?
for
Entonces,
the
hemos utilizado esas
applications that we
metodologías.
develop.
Gracias, doctor Pérez
Thank
Lu.
you, Dr. Perez Lu.
También pregunta Osvaldo
We
nuevamente, ¿se
Osvaldo
podría decir
again
que
is
los L1,
asking
L2,
whether we
L3 y
can say
L4
that
son las fases
L1,
de
L2,
desarrollo del
L3, and
aplicativo?
L4 are the development phases for the
Ahí doctor
application.
Pérez Lu también había dado una
Perez
respuesta
Lu had
detallada.
also shared a
Sí,
detailed
bueno,
answer. Yes,
digamos que esas son las fases, ¿no? Como he
we can say
mencionado,
that these are the
viene también
phases,
hasta el L5
and
y el L5
again,
es la
we
fase que
also
digamos que
have
estamos
L5.
implementando ahora.
That is the one
Digamos que
that
las
we are
primeras fases
implementing
es
right
el
now. The
L1
first
y el
phase
L2, ¿no?
is
Que es la
L1,
parte no digital,
L2,
digamos la
that
parte
is the
análoga,
non-digital,
digamos que es la donde se
rather
hace,
the
digamos,
analog phase,
las
and
directrices narrativas, ¿no?
that's where we
Que lo que
have
dice la
the
normativa es el
narratives
L1,
that we
el
take from the
L2 es,
guidelines,
digamos, el kit de adaptación digital, es como esta
and this is
normativa del
the
L1
digital
se
adaptation,
transforma en
how
casos de uso, en diccionario
L1
de datos, ¿no?
becomes
Y ya
a
digamos la parte digital, que es el
dictionary
L3
with
y el L4,
terms, and
podemos ver el
also
L3,
then we move
es
on to, and we have the
la
digital
parte digital de
adaptation, and then we
coordinación
have
más que todos los
L4, and it has
ingredientes
to
o
do
las
with
cosas
all
que
of
se
the
van a utilizar
ingredients, the
para
machine
hacer los
component that
algoritmos,
will
que
be
es el
used for
L4,
the algorithm
que
that
cómo
is in
interrelacionar
L4,
todos
and
estos
also how all
ingredientes
of
del
this
L3
is
y se convierte, digamos, en
related.
un software.
First
Y
in
el L5
L3
es
to
cómo
become
es que se va a
software,
utilizar toda la
and
información
then
que actualmente vamos
L5
recolectando,
is
¿no?
the
Para la toma
organization
de
of the
decisiones.
information that we have gathered for
Perfecto,
decision
doctor Pérez
making.
Lu. Me parece que
Thank you
tendríamos
very
otra
much,
pregunta para
Dr.
usted
Perez Lu. I think that we
que
have
la
another
hizo nuestro
question for
colega
you,
desde Trinidad y Tobago
and this comes
sobre
from
qué base de
Trinidad and
datos
Tobago as
utilizó
to what
para que
is
la
the
aplicación tuviera esta
database that was
funcionalidad
used for the
offline, ¿no? Si
application designed to support the offline feature.
Bueno, la base de datos que se
The
utiliza, donde se
database
almacena la
used
información,
is resource DB. It's more or less an SQLite adapted for fire. And that's where we store all of the information.
Perfecto, muchas gracias.
Thank you very
En
much.
otras preguntas tenemos a
And
Yelisa
as
Yáñez,
other
que nos
questions, we
pregunta,
have
buen día,
Yelisa
los datos
Yáñez, who's saying,
comparativos de lo
good
que fuera
morning,
el
the
papel a lo
comparative
digital
data
estarán
from
disponibles,
paper
doctora
to
Velandia.
digital, will that be available, Dr.
Sí,
Velandia?
estamos en este
Yes,
momento,
we
queremos
can.
hacer un artículo científico con
Would
esta
like
información.
to
Obviamente,
draft a scientific
encabeza el
paper with this
Ministerio
information.
de Salud
This will be led by the
para que
Ministry
todo el
of
mundo
Health
tenga
so
esta
that
información disponible.
everyone has this information available.
Perfecto, gracias.
Very well, thank you.
Preguntan si se puede tener un acceso
We
de prueba.
are asking
Hay
whether
algunas
they can
preguntas
have
en el
a
chat
trial
también
access.
que hablan
There are
sobre
some questions
si
in
se
the
pueden
chat as
utilizar
to
o si ya
whether
están interoperando con otros sistemas,
this
¿no?
is
Como
already
el
operational or
registro civil,
interoperating with other
salud o clínicas
systems,
privadas. Me parece que eso
health
sería
or
una
public
pregunta para el país.
clinics,
Sea el
and I
doctor
think that this
Perilú
would
o la
be a question for the
licenciada
country. I don't know
Magdalena que
whether this is a
deseen
question for
responder.
Perilú or Dr. Magdalena. Would you like to address this question? As to the interoperability of the system, we do have interaction with the RENEC, that is the civil registry, and this is the basis for us to have the basic information, the baseline information for the individuals that will be vaccinated. As to the health units, they are the ones sending the information, and in the case of private clinics, they do send us the information to our database, and the application interacts with them, and they send the information to the centralized database, and this is the one to be used for the application.
Perfecto, gracias, doctor. Respecto
Thank you,
tema de los
doctor.
accesos de prueba,
Now, regarding to the
entendemos y
access to
seamos atentos
trials,
a la respuesta
and I know that
país, que
this
estamos
is in
justamente en este
looking at
proceso
the
de
country
ver
response,
cómo
they said
puede
we're looking
escalar a
precisely
más espacios,
at
¿correcto?
seeing
No sé si
is
me
how
puede
we
responder la
can
pregunta
provide
también
greater
Marta Ajuacho.
space. And go ahead, Marta or Jose Enrique. Well, looking at starting tomorrow, we're looking at we know that the app has been developed with open source resources and is a public available resource. This is going to be discussed in more detail tomorrow, Friday. Thank you. Well, we have another question. It says, excellent app. What short-term strategies are going to be implemented in terms of connectivity and the implementation of training of healthcare staff that will be using the app? Well, regarding that, the app can function without connectivity. There's no problem with that. Obviously, the app will be synchronized at some point when the user can get connectivity to send the information. And in terms of training healthcare staff in the use of the app, we're looking at a strategy for national implementation efforts, especially in those areas that are lacking in connectivity. The app is designed for this group, this community. In those areas where we do have connectivity, we have other information systems. But this is focused mainly in those areas where there's issues with connectivity that can hinder sending information. Thank you. Gloria asks, with this app in the pilot establishments, we are going to use the app, and at this point, they no longer have to record information electronically because the information will travel directly to the information systems. You don't need to do a dual recording. So if it's if the app offline app, if it's CISE, then you don't need the app offline. Something else to add to that. Yeah, Adriana. the benefit and for nursing staff, the multifunctional efforts, this is a huge advantage because the app works on cell phones, and there you include the total record of children that are, let's say, from health centers, the Icamarca Center, where the testing took place. And that app identifies each child, records them, their profile, and we have that list of names, and it really facilitates the efforts. It really is a overwhelming resource, and this is the objective in Peru.
Gracias, licenciada Magdalena. Vamos a atender un par de
Thank you.
preguntas más porque
We
ya
have a
estamos
couple more
cerrando este
questions
espacio.
because we are
William
now running
Martín
out of time.
Ramos pregunta, ¿cuánto tiempo
Martin
tomará
Ramos
esta
asks, how much
sincronización?
time will it take to synchronize these efforts? Regarding the synchronization, synchronization would be from the moment the app has already achieved connectivity with internet. It will depend on the amount of information that can be stored during the immunization, and that will depend on the internet speed available. Once the information has been submitted to a central location, we can synchronize these efforts with other information systems. Excellent.
Preguntan también cómo sería
And
con
they
el
also
salud,
ask,
¿cuál sería el procedimiento?
in terms of health, what would be the procedure? In Ministry of Health, we have, for example, private clinics. They send information to our central database. So the idea is that we have a centralized database where you have all the information on immunizations. And this will receive information from various sources, from the offline app, the electronic records. It comes also from the health department sources. That's all going to be stored in this central database. And that's from there we can update our information systems in turn. Well, thank you very much, Dr. Perez Luz, Adriana, Magdalena, Kepi. I want to thank all of those of you who joined us. We had people from Argentina, Venezuela. We had people join us, colleagues from Ascono. And we are going to post this presentation at the webinar section of the PAHO website so that you can retrieve and listen to this presentation again. So now for a few final thoughts, we have Dr. Huerta from the Office of Subregions and the PAHO. Go ahead, Piedra. Thank you, Adriana, for the excellent webinar that you moderated. We also want to thank all of the panelists, participants, the PAHO country offices that joined us during the webinar, also all of the immunization agencies and units that joined us as well throughout the Americas. So I'm sure we're going to continue to expand our list of participants. I also wanted to convey warm greetings to our panelists, and I also want to thank, profound thanks to our technical team that participated in making this tool possible, and during record time, because we conducted intense hard work throughout a year. For the last 12 months, we've been intensely involved in this to make sure that all of these resources were available. Thank you, Dr. Perez Luz. I want to thank the efforts of the partnership, the hours invested, getting the right people that needed to be there. It's been a fabulous partnership, and I don't think we could have had a more productive partnership for this effort. So I know I'm not going to go down the list of everyone, but we want to thank the team, not just on behalf of PAHO. This is on behalf of everyone who will be able to use these resources once we've been able to replicate these efforts and expand it. And the pilot project where this initial effort took place really has set the tone. So I want to thank the immunization team. Well, we have the technology team, but the content is immunization. So the entire immunization team, including Magdalena, you and your team, your willingness and support and determination has been just fabulous, without any doubt. And also mention that all of the caregivers, community caregivers, nursing staff throughout the provinces, in the Amazon region, on the border regions, that we're also doing a lot of hard work to make this possible. Community workers, those that took the literacy, IT literacy programs, that participated in those courses. I want to thank Osarela. I hope I'm pronouncing that right. Sarela, the PAHO technical team, Fernando, who was key in this, together with Marcelo D'Agostino, and on behalf of immunization, Marta Velandia, Patricia, who stepped up and took on this high-speed effort. And I know that I'm leaving a lot of people out, but each team leader, I would like them to express their profound appreciation to their team members. I remember the Maureen Birmingham program, a country representative, Jose Villanueva, was a key figure in helping us conduct several efforts in the field offices, the sub-regional team with Patricia, and at the PAHO country office, at headquarters in Washington, Marcos Rebel, as well as other key figures. I won't go into more specific because I'm leaving many people out, but I wanted to recognize all of you, because once the app can be easily downloaded onto our phones, we don't know who was responsible for all of the efforts to make this possible. So again, thank you very much for your comments, your questions. This is going to be feedback that will help us improve the process. We are going to continue with other events, but we're going to be sharing our results through the Ministry of Health in Peru, the Pan American Health Organization, and our key partner, our financial partner, which is a GIZ from Germany. So again, thank you very much, and thank you for your involvement.